When we think about healthcare, the differences between the USA and France are striking. First off, let's talk about access. In the United States, we have a system that's largely based on private insurance. This means that your access to healthcare can depend heavily on your job or your ability to pay. If you lose your job or can't afford insurance, you might find yourself in a tough spot. In contrast, France has a universal healthcare system. Everyone is covered, and it's funded through taxes. This means that no one is left without care, regardless of their financial situation. Now, let's dive into costs. In the US, healthcare spending is astronomical. We spend more per capita on healthcare than any other country, yet millions remain uninsured. A trip to the emergency room can lead to bills that are downright terrifying. In France, the government regulates prices, and while taxes are higher, the overall cost of healthcare is much lower for individuals. Patients typically pay a small copayment, but the bulk of the expenses is covered by the state. Quality of care is another key difference. In the US, we have some of the best hospitals and specialists in the world, but access can be a barrier. In France, the quality of care is also high, and patients often have shorter wait times for appointments. The French system emphasizes preventive care, which means they focus on keeping people healthy rather than just treating them when they're sick. Let's not forget about prescription drugs. In the US, prices can be sky high, and negotiating costs is often a nightmare. In France, the government negotiates drug prices, making medications more affordable for everyone. And what about the experience of visiting a doctor? In the US, the process can feel rushed, with doctors often spending only a few minutes with patients. In France, the average consultation lasts longer, allowing for a more thorough discussion about health concerns. Lastly, let's touch on the cultural attitudes towards healthcare. In the US, there's often a focus on individual responsibility. If you're sick, it's up to you to find a way to get care. In France, there's a collective mindset. Healthcare is seen as a right, not a privilege. This cultural difference shapes how each society views health and well-being. So, while both systems have their pros and cons, the fundamental approach to healthcare in the US and France couldn't be more different.